This chart visualizes the scale of current global emotional distress based on recent Gallup data. We are looking at a baseline where 41% of adults report experiencing a lot of stress, and nearly a quarter, 23%, report daily loneliness. To explain these numbers, popular psychology offers a narrative of biological destiny. We use labels like highly sensitive person, genetic empath, or hardwired trauma to frame our emotional responses as permanent, immutable traits. The scientific reality is more complex. Emotional sensitivity is not a rigid biological reflex. It is a two-part system, combining a physiological baseline with a highly active cognitive layer. This pie chart represents the findings of a massive meta-analysis by researcher Danielle Postuma and her colleagues, synthesizing data from over 14.5 million twin pairs. They found that, across all traits, human trait variance is approximately 49. The remaining 51% forms the second part of the system, the interpretation layer. Your brain has to translate raw physical reactivity, like a pounding heart, into a specific emotional state, like anxiety or excitement. Because this interpretation layer is built from environmental experiences, it is physically malleable. We can systematically change how we process sensory input. This shift in perspective moves sensitivity away from a static genetic diagnosis. By isolating the interpretation layer, we can begin to address the specific cognitive habits that maintain high emotional distress. To understand how to rewire the brain, we first have to discard the amygdala hijack. For decades, neurobiology modeled emotions as reflexes, visualizing a low road where sensory data travels straight from the thalamus to the amygdala to produce hardwired, instantaneous fear. That model is no longer supported by its own architects. Joseph Ledoux, the neuroscientist who originally mapped that pathway, later clarified that the amygdala drives non-conscious threat survival circuits, like heart rate changes or freezing, but it does not produce the subjective feeling of fear itself. The modern replacement for the reflex model is neuroscientist Lisa Feldman Barrett's theory of constructed emotion. Barrett argues that the brain is a prediction engine. It does not sit idle waiting to react to the world. It constantly generates simulations of what will happen next, ahead of the incoming sensory data. To construct a specific emotion, your brain rapidly combines three things: your past experiences, learned cultural concepts, and interoception, the physical sensations from inside your own body. If an emotion is a predictive simulation from past data, then it is a subjective interpretation. It is an educated guess your brain makes to keep you safe. Shifting from a reactive model to a predictive one provides a clear path forward. Our most intense emotional reactions are learned habits, and habits can be overwritten. We can track the origin of these learned emotions directly to developmental psychology, specifically attachment theory. In the 1970s, psychologist Mary Ainsworth developed the strange situation to observe how infants react to temporary separation from their parents. She found that organized insecure attachment patterns, where a child becomes consistently avoidant or heavily anxious, track directly to their history of caregiving. Later research confirmed that only the rare disorganized attachment pattern shows a systematic tie to genetics. The vast majority of our relational sensitivity and attachment behavior is learned in childhood. The question for clinical science is whether an adult brain can physically alter these deeply learned developmental patterns later in life. A 2016 randomized controlled trial led by Christopher Monson investigated this using cognitive behavioral therapy for social anxiety. After successful treatment, fMRI scans showed significant decreases in the participants' amygdala gray matter volume and lowered neural responsiveness to criticism. The data revealed a direct link. The physical reduction in gray matter volume directly mediated the patient's drop in social anxiety. The structural change in the brain caused the psychological relief. Historical developmental observations and modern fMRI scans confirm the same truth. The emotional interpretation layer is structurally plastic and responds to targeted behavioral intervention. Practitioners and patients looking to apply this neuroplasticity face a significant hurdle: filtering out the amount of pop psychology pseudoscience that dominates modern wellness culture. Take polyvagal theory. It is heavily utilized in trauma therapy to explain physical arousal, but it is disputed by psychophysiologists and neuroanatomists. In 2026, a major critique backed by nearly 40 experts dismantled its core claims, pointing out that heart rate variability, often cited as proof of nervous system state, is heavily influenced by breathing rate, posture, and medication. It is not a scientifically valid readout of vagal tone. We see the same issue with the viral 90-second rule, which claims that biological emotions flush from the bloodstream in under 2 minutes, unless sustained by thought. This originated from a single neuroanatomist's subjective memoir of experiencing a stroke. It is a heuristic for rumination, not an established neurochemical law. This distortion extends to behavioral concepts. On social media, boundaries are frequently presented as rigid rules used to control or punish other people's behavior. The actual clinical definition is entirely inward-facing. Psychiatrist Murray Bowen established this through his concept of the differentiation of self. Bowen defined differentiation as the capacity to self-regulate your internal emotional functioning. It is the ability to maintain your autonomy while staying emotionally connected to a chaotic environment without ever demanding the other person change. By moving past these common misconceptions, the focus of regulation shifts. Rather than managing external environments or biological myths, the work centers on internal cognitive reappraisal and the development of self-differentiation. When we try to use brute force to control our emotions, either by burying them or forcing ourselves to feel positive, the brain's regulatory systems actively rebel against us. This chart diagrams psychologist James Gross's process model of emotion regulation. It compares two strategies: cognitive reappraisal, which means reinterpreting a situation early on, and behavioral suppression, which means inhibiting outward signs of emotion late in the process. Gross's findings show that suppression backfires. Hiding your outward emotional response actually increases cardiovascular and sympathetic arousal, while simultaneously impairing your memory of the event itself. If suppressing negative emotion fails, pursuing positive emotion creates its own trap. Psychologist Iris Mouse investigates the paradox of chasing happiness. Look at the trend line on this scatter plot. Mouse's research demonstrates that individuals who explicitly value and chase happiness report lower overall well-being. The harder they pursue it, the higher their depressive symptoms elevate. The mechanism here is expectation. Intensely monitoring your own emotional state sets impossible individualistic standards. When reality falls short of those standards, the resulting disappointment lowers your baseline mood. Fighting your biological baseline disrupts the brain's natural processing. Suppressing negative physical arousal creates physiological spikes, and aggressively chasing positive emotion leads to disappointment. The scientifically validated alternative to suppression is precision. Lisa Feldman Barrett and Todd Kashdan identify this as emotional granularity. High emotional granularity means labeling emotions in highly precise, specific ways. Research shows people who differentiate their feelings accurately are statistically less likely to resort to severe anxiety, to physical aggression, or binge drinking to cope. This fMRI data from Matthew Lieberman's 2007 affect labeling study reveals the mechanism. When subjects attached a specific emotional label to a feeling, activity in the right ventrolateral prefrontal cortex increased. Simultaneously, the limbic response in the amygdala decreased. Notice the limitation in the scan. The amygdala activity dims, but it does not vanish. Affect labeling acts as a brake pedal that reduces emotional intensity. It is not an off switch that eliminates the feeling entirely. This neurobiology supports acceptance and commitment therapy, specifically the technique of cognitive diffusion. Diffusion teaches you to change your relationship to a thought, observing it as a passing mental event rather than fighting its content. By observing and precisely naming our constructed emotions, we utilize the prefrontal cortex to naturally dampen limbic reactivity. We replace rigidity with psychological flexibility. The compelling evidence for this approach comes from Marsha Linehan's dialectical behavior therapy, a framework originally built to treat severe, chronic cases of borderline personality disorder and suicidal ideation. Linehan engineered a core distress tolerance skill that sits at the center of DBT. She called it radical acceptance. Radical acceptance is the practice of fully acknowledging reality without fighting it. Linehan summarized the core dialectic of the treatment. If you are in hell, the only way out is to go through a period of sustained misery. Refusing to accept the misery required to climb out ensures you fall back in. The data shows that for those practicing radical acceptance, there are statistically significant drops in self-directed violence and psychiatric crisis service use compared to standard treatments. The most critical finding in the data is this: DVT profoundly changes behavioral outcomes and saves lives, even when the underlying suicidal ideation persists. The thoughts remain, but the destructive reactions cease. We cannot erase the 49% of our emotional sensitivity that is heritable, but by acknowledging the limits of biological determinism and moving past the failure of suppression, we can recalibrate the interpretation layer, altering how we experience and process our own emotional states.